It is not a bill about abortion. I know it says that in the daily reading. It's actually a bill about human trafficking and creating an intervention point for those who are trafficked, those who are enslaved, and essentially have no will of their own. What the bill does is it creates opportunities for victims of sex trafficking to speak openly with perhaps the only healthcare professionals they'll ever see, and while they're being enslaved. And it provides resources for victims, facility staff, and onlookers. Essentially, we're looking for them to be able to sit down in a room with a healthcare professional without their enslaver sitting there making the decisions. Human trafficking, as many of you know, and many of you are involved in the fight, is at epidemic proportion, and California is at the epicenter of this. California is one of the prime destinations. We're looking for ways that we can combat this and save however many lives that we can by creating an intervention point. According to the another requirement of my bill would be that in every healthcare facility, every emergency room, in any place that offers abortion, there would be a requirement to put up a sign that has the human trafficking hotline right there, so that you're essentially creating a way that they can reach out and call somebody, and that somebody understands that they are in jeopardy, in trouble, in danger, because they don't have the ability to leave the situation that they're in. According to the American Journal of Nursing, most victims have little or no access to health care, but some wind up at emergency departments for treatment of trauma or in community clinics for reproductive care. The Journal encourages healthcare providers to talk with suspected victims in a safe, private environment. AB 1306 aims to provide that environment. Healthcare professionals in these environments are uniquely positioned to address this major human rights violation and be an integral part in actually rescuing trafficked persons. I'm going to read you the testimony of a young woman who testified before the U.S. Senate Foreign Relations Committee. Her name is Rosa from Mexico. She was trafficked to Florida. When I was 14, a man came to my parents' home in Veracruz, Mexico, and asked me if I was interested in making money in the United States. He said I could make many times as much money doing the same things I was doing in Mexico. At the time, I was working in a hotel cleaning rooms, and I also helped around the house watching my brothers and sisters. A week later, I was smuggled into the United States through Texas to Orlando, Florida. It was then that the men told me that my employment would consist of having sex with men for money. I never had sex before, and I had never imagined selling my body, and so my nightmare began. Because I was a virgin, the men decided to initiate me by raping me over and over again to teach me how to have sex. Over the next 3 months, I was taken to a different trailer every 15 days. Every night, I had to sleep in the same bed in which I was forced to service customers all day long. I couldn't do anything to stop it. I wasn't allowed to go outside without a guard. Because I was so young, I was always in demand with the customers. It was awful. Although the men were supposed to wear condoms, some didn't. So eventually I became pregnant and was forced to have an abortion. They sent me back to the brothel almost immediately. I cannot forget what has happened. I can't put it behind me. I find it nearly impossible to trust people. I still feel shame. I was a decent girl in Mexico. I used to go to church with my family. I only wish none of this had ever happened. Ladies and gentlemen, we have an opportunity to reach people at a point where they can be saved. I am not trying to change the abortion laws. Even though I oppose abortion, I understand that is the law of the land. I do think we can use the ability, this intersection where people come for health care, whether they're brought in by their trafficker or not, to grab these people out of this lifestyle, to give them a chance, to give them some tiny bit of hope. I think it is incumbent upon us. It is the least we can do.
We have a motion and a second.
I have one witness.
Witnesses in support.
Good evening, members. My name is Pablo Cibaja. I'm the Legislative Director for Capital Resource Institute. Recently, I visited a BJ's restaurant and brew house. As I glanced over to the menu to select my meal, I noticed every item had next to it a caloric count. Why? It is a result of legislation authored by Senator Alex Padilla and Mark DeSaulnier, requiring restaurants to include such information on their menus. Last night, as I watched Law & Order LA, an Aleve commercial came on. As the commercial concluded, the announcer listed possible side effects. Prolific medication like Aleve, which relieves osteoporosis, is required by law to disclose possible respiratory, cardiovascular, metabolic, renal, and nervous system side effects. Producers of commonly used medicine have to, by law, disclose possible side effects. Abortion is not a light subject, and in fact, the extraction of a human being from a mother's womb does have side effects. Why should we tell restaurants they must disclose the caloric count of their meals, or tell a pharmaceutical company they must disclose possible side effects, yet deny a woman the right to know the potential side effects of an abortion? Let me read a story from a woman who underwent an abortion. I was 22, working to pay my way through college. The summer after my freshman year, I got pregnant. Afraid, ashamed, and unable to fathom the thought of interrupting my education, I made a mistake I deeply regret. I had an abortion. She continues on to say, women have abortions for all different reasons. Surveys indicate that the majority of women have them because they lack the financial means or emotional support to carry the pregnancy out. Less than 5% choose to have an abortion because of medical reasons, rape, or incest. These are also women and girls forced to abort by parents, a significant other, and more frequently than acknowledged, by a sexual slave master. She said, I chose to abort because I was afraid of what others would think, couldn't imagine how I could provide for a child, didn't plan the pregnancy, and didn't know what to accommodate the interruption, and was in a situation that I didn't want others to know about. She said, I came to believe that what I did was terribly wrong. Unprepared for the intense emotional upheaval, it was difficult to articulate how I felt, and I also kept it bottled up inside, quietly, living in pain. People have tried to console me by telling me I was young. Unfortunately, that doesn't make it any less painful. Not all women regret abortion, but many do. We managed to deny it for decades, but it lurks in the back of our minds, the depths of our hearts, and the pits of our stomach. Leaving a legacy of pain has often manifested itself in psychological trauma, addictions, depression, physical illness, miscarriages, and in some cases, suicide. She said it has a detrimental impact on our families and our employers. Recently, she said, I realized that had I not aborted my oldest child, he would be 21 today. Not unlike a miscarriage, I will deal with the loss of that for the rest of my life. In essence, I'm serving a life sentence. So a vote for this bill, a yes vote for this bill indicates you are in favor of a woman's right to know. And by voting against this measure, you will be depriving girls, teenagers, and women from vital information. So for these reasons, we stand in support of the member's bill and urge your strong support.
Thank you. Other witnesses in support? Witnesses in opposition, please come forward.
Good afternoon. Shannon Smith Crowley, representing the American Congress of Obstetricians and Gynecologists. We are opposed to this bill, and we appreciate the interest of the author in the issue, and the very serious issue of human trafficking, which includes also sex trafficking. However, this bill really doesn't get to the heart of what the need is. There's a state task force looked at the issue of human trafficking, and amongst the many recommendations that it suggested training for first responders, including physicians, police, fire, social services, and that's where funding is needed to support those trainings, and that would be the correct intervention. Here, this bill would limit a woman's privacy right as to who she would have available with her at the time of counseling. She may not want a family member to be attending this. And for those women who have been rescued from trafficking, who may be accompanying them is the FBI or social services agency. So they may be from another country and not have somebody with them. So for various reasons, we ask for a no vote on this bill.
Jody Hicks with the California Medical Association, and I would echo many of my colleagues' comments. Having personally worked on human trafficking, legislation in a past life. This is an important issue, and commend the author for working on these, and would be happy to sit down and talk about how the California Medical Association, or just personally, we can help or try and find ways to work on this issue, because it is an important issue. The bill as it stands, though, does have problems for healthcare providers, and when they are, the way the bill is written, as my colleague pointed out, specifying who can be with a patient not only interferes with the physician-patient relationship, but also with the patient and their rights to have whoever they're most comfortable with them, whether it's a sister, which would be prescribed in the bill, but a best friend or whoever they're comfortable with is who should be accompanying them. And while we do recognize the goal of not wanting to have someone who's putting undue pressure, we believe that healthcare providers are trained and already mandated to report when they believe something is wrong. And in addition, the signage requirement, again, while we would commend trying to bring awareness to this issue, it shouldn't be prescripted only to those providers that do abortion. If we're going to mandate awareness, it really should be to all areas where people would be, emergency rooms and any areas where victims might be. So for those reasons, we must oppose the bill today, but again, offer any kind of meetings or sit down and talk about the issue, because it is an important one.
Thank you. Now, witnesses in support, witnesses in opposition, following those two testimonies, name and organization into your opposition.
Kathy Mossberg, representing the California Family Health Council. We are opposed.
Charlotte Newhart with the American Association of University Women in opposition.
Lori Jones with the California Primary Care Association, opposed to the bill.
Brianna Pittman, Planned Parenthood Affiliates of California, strongly opposed for the reasons stated.
Mary Weiberg, a Commission on the Status of Women, strongly opposed.
Good afternoon. Valerie Small Navarro with the American Civil Liberties Union, also in strong opposition. Thank you.
Chair Member Stephanie Roberson on behalf of the California Nurses Association, also in opposition.
Thank you. Seeing no further testimony, we'll turn to committee members. Questions, comments? I have Ms. Mitchell.
Mr. Donnelly, as a woman of reproductive age, I'm compelled to try to seek some clarification from you. Section 1 of the bill, lines 9 and 10, only verified immediate relatives or legal guardians of the woman seeking an abortion may join the woman in the counseling room. How are you going to identify who an immediate relative is? And I guess that also would preclude the man who would have impregnated me from joining me in the counseling room?
Well, that's not the intent of the bill. I appreciate your question. The intent of the bill is to keep the trafficker out of the room. And with all the opposition that has been stated in terms of the concerns of the medical professionals, we would actually be open to removing that part and would be content to only put the sign up in all healthcare facilities, including every place that an abortion is performed.
Thank you for that clarification.
Any other questions or comments? Seeing none, there is a motion and a second to pass and refer to appropriations. I cannot support your bill today, Mr. Donnelly. I think the opponents framed some of my concerns. I find it a little concerning that your representation, that this is focused on human trafficking, not on abortion, and then your one witness in support spoke exclusively about abortion and his opposition to abortion. I think a more ingenuous or more genuous approach would be other points of contact for posting about services for victims of human trafficking at retail centers, perhaps areas more commonly frequented by traffickers and their prey. But for those reasons, I cannot support your bill today. I will be voting no, and I ask the clerk, let me afford you the opportunity to close.
Thank you.
And then we'll call the roll.
Thank you, Mr. Chair. It's an interesting conundrum when you're a Republican and you present bills. And I had a bill earlier today where I had tremendous support from all kinds of places. And that bill addressed sexual trafficking and not abortion, and it was killed. I find this talk all day long about how we want to address this problem, we want to solve this problem, but then I see all these reasons why we're just going to ignore it. I have just stated that I'm willing to take all of the abortion provisions out of the bill. I am completely opposed to abortion. I am doubly opposed to an abortion that is forced upon a woman who is enslaved, and especially when many of these are minors. The intent was to protect those who have no way to protect themselves. So I disagree with your analysis and characterization of my intent. I have run multiple bills on this subject. I am absolutely committed to working with anyone, and I have supported bills with people who have killed my bills. So the one thing that I am committed to is solving this problem, whatever it takes. I don't care who I have to work with, but I would appreciate people to just do one thing for me. Put yourself in the mind of a 12, 13, 14-year-old girl, just for a moment, whose parents are not within reach. The society, we have failed them. And all I'm asking for is that there be a sign posted so they can call a number at a place where they're about to possibly become a victim yet one more time.
Thank you.
So, thank you.
Thank
With
you.
that, I ask for your aye vote.
Thank you, Mr. Donnelly. I think you framed your concerns very clearly. I think there's an honest area of disagreement here as to what the bill may or may not do. We've heard, I think, a healthy and principled and respectful discussion on it, and I would ask the clerk to call the roll.
Monning?
No.
Monning, no. Logue? Logue, aye. Amiano? Amiano, no. Atkins? Atkins, no. Bonilla? Bonilla, no. Ing? Ing, no. Garrick? Garrick, aye. Gordon?
No.
Gordon, no. Hayashi? Hernandez? Lowenthal? Lowenthal, no. Mansour? Mitchell? Mitchell, no. Nastandi? Nastandi, aye. Pan? Pan, no. Perez? Perez, no. Silva? Silva, aye. Smythe? Smythe, aye. Williams?
Thank you, Mr. Chair.